All right, episode 440 with Dr. Chad Edwards is brought to you by Anne-Marie Gianni Skincare. And as many of you guys know, our skin is our largest organ, and it's also the place where we ingest unknowingly many toxins and poisons. And Anne-Marie Gianni's got a really, really great thing going on over at AnneMarieGianni.com, and they have wild-crafted organic skincare products. And there's even a skin score quiz that you could take on their website as well to find out and determine what kind of skin you have. And these are all organic, wild-crafted ingredients with no parabens, phthalates, or any toxic, weird stuff. They have a $10 sample kit, which is what Kate and I did when we first bought our first thing, and just bought the $10 sample kit, and now we are absolutely hooked, and we buy them all the time with all kinds of really great skincare products, sun protection products, makeup. I don't wear makeup, but Kate wears makeup. So they've got purifying mud masks, facial cleansers, aloe herb cleansers. It's just amazing stuff. And I really cannot recommend them highly enough. So I want to let you guys know about Anne-Marie Gianni Skincare. And we're also brought to you by the Bellicon Rebounders. I've told you guys this multiple times. You know, many of you can buy lots of different rebounders, and eventually you're going to get what you pay for. The Bellicon is the absolute best rebounder. It's a cellular exercise. It increases bone density, increases circulation, and because it's a cellular exercise, it actually stimulates every single cell in your body, and it helps detoxify your lymphatic system, increase lung capacity, and it's just a great exercise to do that you cannot really replicate in any other capacity. Bouncing up and down on a trampoline is incredible for your health, and I do it every single day. Haven't done it for about 2 weeks because of my back issue right now, but it really feels like you are jumping on air and you're jumping on a cloud with these flexi ropes. So the Bellicon's silent, and it stores easily. The legs can fold, and you can put it underneath your bed. And if you're concerned about keeping people awake at night, if you're doing it, it's completely silent, and it's just an incredible piece of equipment that I can't recommend highly enough. So if you guys are interested in the Anne-Marie Gianni Skincare or the Bellicon Rebounder, the best thing to do is just go to extremehealthradio.com/440, and there'll be links to both of those products. Okay, welcome everybody. We appreciate you guys being on the show. This is fun for us. I tell you, this is not even like work, is it?
This makes my Friday.
How could this be work?
What a great way to start a day. How could this be work, right?
I know, right? We get to talk to the most amazing people, interesting people, so many fascinating people that we've talked to. Just bizarre, strange, awesome, doing amazing work. I love it. They're all just eclectic and fun.
I didn't know what I was getting into 4 years ago, did I? I had no idea any of this existed. Prolo, what?
I know, right?
Detox, what?
Detox, what?
This is good.
So this
good
is
stuff.
Fun. All right, so this is episode number 440. Pretty cool, huh?
Yeah.
So we're just plodding along here, doing lots of interviews. So we're up to about 3 a week now, which is great. So today we got Dr. Chad Edwards, and we're going to be talking with him in just a second. If you want to listen to this particular podcast on the website, you can do that at extremehealthradio.com/440, and that will just link you right over, and you can see any of the links that we talk about. Actually, we won't be doing many show notes, but it's part of what we're able to do by doing more shows. So let's see. Happy holiday weekend, everybody.
Yep. Wow, a year has gone by since I feel like we just had the 4th of July.
It goes by fast, doesn't it?
Yeah, here we are.
So today we have Dr. Chad Edwards, and he is with Revolution Health and Wellness. His website is revolutionhealth.org, and he holds a BS in exercise and sport medicine. And he's also attended the medical school at Oklahoma State University College for Health and Sciences, completed his residency work at Womack Army Medical Center at Fort Bragg. He was a battalion surgeon, special operations unit in support of Operation Iraqi Freedom. He's an emergency room physician in hospitals in Tennessee, and is doing some really cool stuff over at revolutionhealth.org. So thank you so much, Chad, for being on the show today.
Hey, it's a true honor to be here. Thanks so much for having me.
Yeah. You sounds like you are doing some really cool stuff. It says in your bio that you're doing some emergency physician work and surgery. Are you still doing that?
Yeah, and I'm actually in Oklahoma now. When I was still active duty, I was working in the emergency rooms there in rural Tennessee, quite a bit. And now I'm back in my home state of Oklahoma and doing the same kind of thing. And I found that as I was in my clinic doing functional medicine, you just kind of creep further and further away from acute care and mainstream medicine. And I'm fairly critical of mainstream medicine a lot. And one of my things is if I'm going to be critical of something, that I better know it better than anybody else.
Mm-hmm.
So,
well, you're more honorable than I am. Well, you're more honorable than we are because we're critical of it. We don't know anything about it.
Right. Just our own experience, but that says a lot.
Yeah, that does say a lot.
I think it's important when I start talking to other physicians about, the way things have gone wrong. If I don't know better than they do, then I'm just a weirdo idiot. But when you can go to them and say, here's the evidence, here's what this really says, here's what we should be doing, here's what we're currently doing, this is wrong, then they have no recourse.
So I have to ask you, blending the two worlds, we've had a lot of people on the show that are naturopathic doctors and quite a few who are medical doctors, but we've had a few that are sort of a hybrid of the both. So they still hold their medical license, but they practice natural medicine. And those people seem to be very, what is the word? Like they're very concerned about, their license being taken away, and they're very just, I guess, uptight, but justifiably so because, the licensing and everything like that goes along with it. Do you have any issues with blending the two like that?
I really don't. My thought is if I'm doing the best thing I can to take care of my patients, that's what I'm supposed to be doing. That's what I'm sworn to do. That's what my oath says to do. And certainly when there's a little bit of a concern when you go against, quote, standard of care, that can always raise a flag. The way I would describe standard of care for the listeners that don't understand what that means, standard of care is simply, that question that your mom asked, well, if your friends jumped off the bridge, would you jump too? Standard of care says, yes, you would. And that's literally all it means. There's no evidence necessarily for standard of care, although there may be, and many times there is. But just because it's standard of care does not make it right, does not make it what we should be doing. It's just what everybody else in your field is doing. And so if you're doing something different, then certainly it can raise a red flag, and it may put the light on you. But my whole goal is when my patient comes in to see me, I'm doing the best I can to balance risk versus benefit. So when the benefit outweighs the risk, then that is an intervention that we're going to entertain. It's on the table. When the risk of harm is there, then we have to be very, very, very careful. And there's a lot of things that I think may be very beneficial. And one thing, to raise a very controversial topic is an anti-cancer chemical called Latrell. Or B17. And there's been a lot of negative stuff about that. And when I started looking into it, there is some question of harm. Now, it may be contrived, it may be whatever, but that's something that I don't do in my clinic because the FDA has said there's potential harm in this, and there are patients that I think would probably benefit from it, but balancing that risk benefit, I can't go there. Yeah. Vitamin C, on the other hand, there is no evidence of harm, and there is lots of possibility of benefit. And in fact, in the 1940s, it cured 60 out of 60 cases of polio. And so when we have a significant benefit with no real risk, even though it's not, quote, standard of care, then why would I not entertain that? So I believe that what we do in our clinic is justifiable, and I believe that it's in the patient's best interest. And if anybody has a question about that, I'd be happy to talk with them. As far as my licensure board and those kinds of things.
That makes sense. We had a doctor on a while back, and he was going through the ringer with the medical establishment, I guess, and they wanted access. At this time, this was probably about 20 years ago, and they wanted. He was anesthesiologist, so he was deep in the medical field, and they wanted access to all of his patients' records, and he wouldn't give it to them. And then so he went back and asked all of his patients, are you willing to give your records to the FDA because they want access to your records? And all of them said no. So he went back to them and said, sorry, I asked all my patients.
Protecting them, right?
Protecting them. And as a result, they took his license away. Mm-hmm. But one of the things he shared a story about was when someone would have like a catastrophic thing happen under a doctor's care, and the doctor came under review, they would just say, did you practice the standard of care? And if the patient died and he said yes, then it was just case closed.
That's right.
No big deal. You know, isn't that crazy?
Right.
That's nuts.
Yeah, it's unbelievable. It's like we've lost the passion to protect our patients. And I've got some fantastic friends that are amazing people, amazing physicians within traditional medicine, and they kind of practice that way. And I understand, and it really takes a gutsy person to step out of that box and say, you know what, I'm going to do it different. Yeah. But I believe that I'm called to do this, and my allegiance is with my patient. Period. End of story.
Yeah, just like this guy. Yeah.
Yeah, love it.
Yeah, it's good. So are you able to, or do people request actual regular pharmaceutical medications from you?
Absolutely, and I do use them.
Mm-hmm.
The problem is, there was a study in 1998. It was published in, I think it was JAMA, Journal of the American Medical Association. I've got it on my website. That, in fact, I just had a podcast about it recently. That the number 4 cause of death, it was either 96 or 98 that it was published. But this is mainstream medical journal stuff, peer-reviewed journal. The number 4 cause of death in this country in 1994 was properly prescribed medications. These were not drug interactions. They weren't overdoses. They weren't, inappropriate, just administered. They weren't drug administration errors. These were properly prescribed medications. It was the number 4 cause of death.
Isn't that
in this
crazy?
country?
That is so nuts. Yeah, I've heard the stat about it. Like, isn't it 100,000 people a year die as a result of properly taken medication?
I think they factored it, and I got the actual numbers on my website. I can't remember off the top of my head, but I think it was over 200,000 in that particular year. I may be getting that mixed up. It could have been 2.2 million that had a serious adverse drug reaction, and serious was defined as had to be admitted to the hospital, had a permanent change in their health, or died.
Well, to me, it doesn't matter if it's just one, right?
Sure.
If one person dies from taking milk thistle, you hear it all day long.
Right.
And the point of that, and I don't mean to vilify medicine across the board. I believe they serve a critical role. Mm-hmm. The problem that I have is when we just, without balancing the risks, say, oh, you have high blood pressure, here's your pill. And that's what we do. I mean, in mainstream medicine, that's what we do so often. And I think part of it, there's a lot of reasons for that, but I think part of it is because we don't have time. We don't have time to listen to the patient. We're supposed to see 30 patients a day. We've only got 10 minutes. We compartmentalize all of these problems, and we say you've got a diagnosis of high blood pressure without looking at your physiology has gone awry. And so you've got this problem. Here's the pill that fixes that problem. Moving on.
Yeah.
And we don't understand that there's another way, and the way that we're doing it is wrong. And so it's just this reductionist medicine. Here's your problem. Here's your pill. And we don't look at the risks, the potential risks of these medications. And I was in the emergency room the other day. I was talking with one of the nurses, and I said, if you look around, I had a 95-year-old lady that was just amazing. Sharp as a tack. And she was on like one medication. And I was talking with her nurse, and I said, the interesting thing is we don't see 94-year-old people coming into the emergency room on 20 medications. You don't see it. Because if they're on 20 medications, they're already dead.
Yeah, they're not making it that far.
You could make the argument that, well, they're healthier, so they don't need the medications. And I think there's probably some truth to that, but I would argue that it's probably that they're healthier because they're not on medications. And at that age anyway. So it's all about balancing the risk and benefit. And when you get patients, and it's also the paradigm shift on focusing on health versus focusing on disease. And within the disease paradigm, when you go to your doctor, everything is based on the International Classification of Disease, ICD-10, or ICD, International Classification of Disease 10. So anything that you do, that your standard doctor does, has a code for the diagnosis, and everything they get, labs, medications, it's all based on this ICD-10. It's focused on disease. It's not focused on health. When you focus on health, by definition, the two are mutually exclusive. Mm-hmm. You can't be diseased and healthy. So when you focus on health, the disease often will kind of take care of itself. So it's about balancing risk and benefit for a problem. Make the problem go away. Don't worry about the medicine.
So when someone gets a diagnosis of, say, diabetes, like they say type 2 or type 1, that actually corresponds to a numerical code?
That's correct. And the ICD-10 has it's a letter and numbers. So and there's all these different subsets. And when ICD-10 came out, there was a big, I don't maybe get too deep in the weeds on this, but there was a lot of eye rolling and we're going to have to focus on all these codes, and there are so many more codes. And the purpose for this is epidemiologic data collection. I'm not a conspiracy theorist, so I don't think that they're cataloging individual this disease, this not on a large scale level anyway. They're not
trying to reduce the population of the entire planet.
Right, exactly.
Yeah.
But they are looking at what's the incidence of high blood pressure that causes this. They're trying to they're trying to distill everything down to codes and look for trends and things like that. So it's data collection in that regard.
Isn't that interesting?
And so you'll look, it's not just type 2 diabetes. In fact, finding the code, it's type 2 diabetes with retinopathy without, this, and there's a code for that. Then you get without retinopathy with this is a different code. And there might be, 500 codes just for type 2 diabetes.
Oh my goodness.
I had no idea.
Yeah,
I've never heard this before.
Increasingly difficult for your standard physician to find the right code. And then, of course, now insurance companies will say, oh, that's not the right code for this, and you did this, and you should have used this code. And so this is why the cost of medicine goes up and up and up and up, because we have to have somebody that their whole job is to translate a bunch of codes that I can't keep up with all that. Wow.
There's a doctor that we spoke with, and he was saying that, talking about the standard of care, and these codes just completely remind me of that. And he said that, his contention is just like yours, is that every person is unique and different, right? And so he says, as soon as the standard human being walks into my office, then I'll give them the standard of care. But until then, I've never yet met a standard human.
That's exactly right. That's exactly right.
Everyone's so different, right?
How can there be?
Yeah.
Exactly. And that is a foundational principle for looking at something from a functional medicine perspective, and why we will do things that the evidence-based medicine doesn't go along with, and it's because you cannot get a study on all of these and control for all of the little nuances that will affect the outcome. They think that there's what's called a washout. By the time you get a sufficient number of people, that it just kind of washes out all these little individual variances. And the problem is there may be something that we haven't even yet identified. And, Bones from Star Trek may have known about it, but, we don't yet. And there may be some gene or some little chemical or, all of these kinds of things that one day will explain cardiovascular disease. And if you have, this particular thing, then you're going to get cardiovascular disease independent of your cholesterol. And right now they're doing the best they can with the data that they have. I think they've been misled, but that's another topic.
I'm glad you just brought up, I was actually going to kind of ask you your thoughts on genetic testing. Do you guys do that at your clinic? And do you see that as an important part of this? Because I know there's the whole epigenetics that, you can switch on and off genes. But yeah, what kind of role do you think this plays in kind of diagnosing someone's issues?
Well, yes, we do genetic testing in our clinic, and it does help us understand the bio-individuality of each patient. But I've seen a lot of emphasis, like, for example, MTHFR. I'm sure you're familiar. So that particular gene, I get patients that will come in and they say, well, I've got the MTHFR, so I can't do blah, 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 blah. And I don't think that's true. I think it's important to understand, and it helps me to watch for certain things. But that implies that over the last 100 years, there's some big, development that has changed all of our patients.
Right.
And our genetics haven't changed in 20,000 plus years. Mm-hmm. So, over tens of thousands, if not hundreds of thousands of years.
Right.
And so our genetics haven't changed. Why all of a sudden do we care about MTHFR?
Right. That's my big thing, because it's like this buzzword. It's the popular gene problem. So what's going on, do you think?
Well, I think it's the epigenetic factors that you're discussing. So, when you think about, MTHFR plays an important role with methylation, which is involved in phase 2 detoxification. So when we're trying to detoxify chemicals and get them out, that's an important component, specifically with hormones. So estrogens get metabolized and they go through phase 1 hydroxylation, phase 2 methylation. And if you don't methylate well, then you may have an increased risk of cancer. And so you will want to do things that will enhance your methylation. So when you're taking in, fake hormones, or if you're taking in, heaven forbid, an equine estrogen like Premarin, then you're going to be at risk for shunting your estrogen metabolism through the 4-hydroxy pathway. And if you don't methylate well, then you are funneling all of those chemicals directly into a pro-carcinogenic state. And so it becomes important in that regard. Then when you factor things like BPA, which was originally designed as an estrogen, and it got incorporated to plastics, and I don't remember the process or why. But so we get these estrogens that leach into our foods and waters and things that will alter our hormone status, and we have to metabolize those things. I think it's that I'm using that as an example of why I think methylation is suddenly important.
So do you think BPA might be one of the biggest reasons people are having issues with methylation? Because like you said, our genes haven't changed in 20,000 years. And
just hormone disruption in general.
It could be one of the top factors, you think?
I don't know if it's one of the top. I think it's important. And I think there's a lot of stuff, and there's certainly a bunch of stuff that we probably don't even know about yet, that explains why. I mean, it's one of the reasons that I'm pro paleo. It's one of the reasons that and not that I think paleo is the end all be all, but when you eat clean, you eat food the way that it was created and placed on the planet, and with, unpolluted by, mankind, and, it's free range beef and, natural things without pesticides and herbicides and all of these kinds of things, then it just removes the question. And it may not be, we may not ultimately need that level, but it removes the questions. So that's why I'm in favor of that. And there's a lot of patients that get better when we do that. And they'll ask, well, what was going on? I don't know. It's one of, 10,000 different variables, and, 5,000 we're not even aware of yet. So it just removes the question for me, gets everything clean. And we're just going based on what's been established for, tens or hundreds of thousands of years.
Well, so I'm curious, Dr. Edwards, do you think that the testing, like the 23andMe's, are the way people should go? Or are there more definitive or deeper tests that you guys perform even at your clinic that are different than that?
Well, I think 23andMe is very interesting, and I'm certainly not opposed to it. I do think that some patients they lose the forest for the trees. And they'll get their genetic testing, and they'll come in and they'll say, oh, see right here, I have COMT and I can't do this. Well, I mean, your ancestors had that too.
Right.
And, they were presumably healthy, and you're having a specific issue or a specific complaint. I would argue that there's probably something that we haven't yet identified, in as far as their environment, their, those kinds of things. It's easy to get into the nuances of some of this and really get bogged down on, I've got to take high levels of methylcobalamin to, balance out which again, I don't disagree with that.
Right.
And
but
I've got a lot of patients on methylcobalamin.
Person to person though, right?
Right, exactly.
Right.
And I will evaluate their methylation ability, and one of the ways that I do that is checking a homocysteine level. It's kind of a poor man's methylation test, and because you can have I get a lot of patients that have MTHFR, even homozygote abnormal. They've got both of the abnormal genes on that 677 SNP, but they're methylating very well.
Interesting.
Well,
yeah,
because that gene is just telling us that enzyme is not functioning at full capacity. It might be 50% capacity.
Right. Yeah, I agree with that. I've had a few friends that have had the 23andMe test, and it's funny to see how even their mind plays tricks on them. After you have this test, all of a sudden you think, oh, you're right, I can't eat this, I can't do this, and it becomes a sickness that they didn't feel before. It's an odd thing.
That's so true.
So you got to be careful.
I'm not opposed to it. I think it's good information, but it's one of my favorite sayings is getting some of these tests. It's kind of like picking your nose in public.
Totally.
Yeah, that's
what are you going to do with the results?
Right. Well said.
That's a good one. Hey, I wanted to ask you really quickly about because it's coming into summer, but we have people listening, in Australia and south of the equator and all different times of the year. But here right now, it's coming into summer, and you recently did a podcast. For those that are interested, if you go to againstthegrainpodcast.com, you can listen to all of Dr. Chad's stuff. And one of your recent ones is sunscreen and it's SPF, and you can't walk down the street. We're about 2 or 3 blocks away from the ocean, and you can't walk down the street without seeing some mother slathering on
spraying on, unfortunately, these days.
I can't even breathe. I walk by them and I can't even, I got to wear like a gas mask.
For 5 minutes after.
Right. Yeah. And tagging onto the BPA thing and looking at some of these, some of the chemicals that are in some of the sunscreens, and those are the ones that you can buy at, the convenience store down the street or, any of the department stores. Spray on, they're nice and easy, and we've been bombarded with this data or this thought that we've got to protect from the sun. Mm-hmm. And I don't totally disagree with that, because let me back up. I don't believe that sun exposure is harmful. It's harmful to the skin. It's good for our overall health. Mm-hmm. Vitamin D levels go up. There's mood enhancement from sun exposure, those kinds of things. But without question, it does deteriorate the skin. So, unfortunately, most of the data about sun exposure and skin comes from the dermatology people, and the dermatology people focus on skin. They don't focus on the overall patient. They focus on skin. So when you only look at the skin, then you'll say that sun exposure is without question bad, and you've got to protect yourself from the sun exposure. So I can't totally 100% disagree with that, but it's about a balance. The biggest thing that I would say is don't ever, under any circumstances, get burned. There's no question that that's harmful. Mm-hmm. And all of the data, all of the evidence points to risk for melanoma is from sunburns, not sun exposure. People that have chronic long-term sun exposure get basal cell carcinoma and squamous cell carcinoma, not particularly melanoma. Hmm. And you can get melanoma in a non-sun exposed area, like the bottom of your derriere. Yeah. And presumably we don't get a lot of sunburns on our rear ends. So you can get melanoma in an area that doesn't really get sun exposure. So it's not just sun exposure into that area. So in looking at the entire patient, in looking at the entire picture, I think a little bit of sun exposure is good and helpful, but we don't want to get sunburned, and I think sunscreen and the SPF is a good idea. The spray-on cheap stuff, bad idea. That stuff gets absorbed into the skin, it gets altered, and you have a toxin floating around in your body. So we were talking about BPA and how its effect. I think these sunscreen chemicals are another one of these toxins that we get exposed to that alter some of those epigenetic components that alters the DNA and risk for cancer and hormone metabolism, and then may raise the evidence or maybe raise the issue with MTHFR and all of those kinds of things. So our recommendation is to use a microencapsulated chemical, which means they're using chemicals, but they're encapsulated in a way that will not allow them to be absorbed into the body, and they work on the surface of the skin. And then certainly these micro minerals like titanium and zinc. Mm-hmm.
Mm-hmm. Yeah, you see the lifeguards with the zinc.
Yeah, I was going to say Baywatch back in the day. They knew what was up.
Yeah, absolutely.
Before they threw it in an aerosol can, it was actually a good thing.
Yeah,
that's right.
Yeah, so zinc is a good thing. And, there's all kinds of natural sunscreens nowadays. When we first started buying ours, like maybe 6 or 8 years ago, it was sort of like there was only one or two to choose from. But now there's all kinds of natural sunscreens.
Right.
Yeah, it's hard not to cringe though when you see, you know, I take
I know.
trips to Disneyland with my family because we live about a half hour away and we have these passes, and every other mom they don't know. They're spraying their kids down, and it's just, it makes me cringe inside, and you want to go up and tell them, but unfortunately, you know, the mass population just don't see the problem with it.
Yeah, and you can't go up to complete strangers either.
No.
It's not so good.
Yeah, then you're going to be the weirdo.
Yeah, then you're going to be the weirdo.
Hey, what was your podcast called? The Skin Pen. What was that about?
Yeah, so there is we talked a little bit about prolotherapy, and Skin Pen is prolotherapy for the skin. So your skin is composed, it's got collagen in it, type 1 collagen specifically. And as we age, and certainly with sun exposure and things like that, you have a destruction of collagen. And so that's where we start getting some of these fine lines and wrinkles, and we start getting some of these age spots and discolorations. You can get scars from acne and from a bunch of different things. And actually, a lot of wrinkles are actually just scars. Skin Pen is a micro needling procedure that it's almost like dry needling, and it just goes into the skin and it stimulates a little bit of an inflammatory response, and it does a fantastic job of growing new collagen. And so as we grow collagen and as that collagen matures, it shrinks. And so it tightens up skin. It's almost a poor man's facelift. And it can remove some of the scars, and it can remove some of the fine lines and wrinkles and the aged or the discolorations and sunspots and those kinds of things. It's a fantastic procedure.
Is that a painful process or not at all?
You know, I had it done, and we use an anesthetic cream, and I was like, that crap kind of hurt. And I had my nurses that were like, oh, it's not that bad. And I was like, okay, you guys that go get like stuff done and electrolysis and all that I guess you get used to it or something. But I will say that I've had patients that I've done the procedure the same on 2 different people, and one barely even felt it, and the other one was like, oh, that was awful.
Yeah. Wow. Yeah. I guess
Everyone
it depends on a person's pain tolerance or what they're comfortable. Right. Yeah. How many people are getting acupuncture, or you might be used to something like that.
That's true. That's true.
Interesting. I've never heard of such a thing.
So
it's a great procedure. It works very well, and it's very cost effective.
Now, I've been doing lots of collagen. I've been doing that beef gelatin. I put it in my coffee drink in the morning. Consuming lots of collagen lately. How, other than eating collagen, is there a way to increase your collagen levels? Because it's not just good for skin; it's just good for joints and connective tissue and everything, right?
Right. Well, my focus is to look at basically how your body produces collagen, and then what is destroying collagen, and ultimately what you have is a balance of those two things. So we want to, as far as the sunscreens and with your skin, protecting your skin from that damage, and that's the way we work on some of the loss of collagen, but then the enhancing the synthesis of collagen. And so there are some supplements, and one that I highly recommend is one from a company called Zymogen, and they call it Regenemax.
How do you spell Zymogen?
XYMOGEN.
Okay.
I had to.
Okay. Yeah, that's a hard one. Okay.
It's a fantastic company. All of their supplements, and I actually wrote a book. It's more like a booklet, and you can get it on my website, revolutionhealth.org, and look at the supplement tab. And there's you can just go download the free ebook. But it's about a 50-page book on supplements and why I think we should be using supplements. Why most people benefit from at least some, even though I think that we should be able to get it from whole nutrition. Just that the book goes into all of that stuff. Okay. And then it goes into the quality of supplements that are out there, and there are some that's just flat scary. And Zymogen, passes all of the California's proposition, whatever the number is,
65
I can't remember.
or whatever that is.
There you go.
Prop 65.
They're compliant with all of those things. They are manufactured in an FDA certified pharmaceutical manufacturing facility, which means that everything that's produced in that facility is the same standard as a pharmaceutical. So they're very tightly controlled. It's probably the best supplement company that I've seen, and I highly recommend them. And so I'm going to start carrying a lot of stuff on my website, and I'll have to private label them, because I can't just sell Zymogen stuff on the internet. They don't allow that.
Gotcha.
So, at least some of the stuff would be that, but I can't say which ones it is.
Yeah. I'm glad you kind of touched on that, because supplements, a lot of people, myself in the past, you hear stuff about supplements, you think they're all good for you, you just kind of throw all of them at the wall and see what sticks. But as I've gotten farther in my health journey, I've worked with some, integrative doctors and things who, like you, are very careful of what supplements, what person is taking when, for how long, why we need them. Some we're just wasting money even.
Right.
Or doing harm when we might not know exactly what it is our body is needing to heal.
That's right. And, when you get a supplement, because supplements, some people say they're not FDA controlled. Mm-hmm. They are actually, but they're FDA controlled as a food, which is a very different standard than as a pharmaceutical. Mm-hmm. So the Attorney General in New York in February of 2015 pulled, and I go into this detail in the book, but they pulled supplements from GNC, Target, Walmart, and Walgreens in New York. They pulled supplements off the label, had them tested, and some of them had none of the ingredient that was titled. So like echinacea, for example. And it had none of the echinacea in the bottle.
No way.
And then some of them, yeah, absolutely. And I've got you can pull up the actual report from the Attorney General in New York, which I did. Wow. I pulled up all the reports, the letters from the Attorney General to each of those places, and it went into the detail of, 56% of these had, 25% of what was on the label. So you have, and Consumer Labs has done a lot of work with this as well, where they tested the stuff, and a lot of them don't have, as it's marked. So they, if it's got 100 milligrams of vitamin X, whatever,
mm-hmm.
But it only has 25% of that. That's one problem. Insufficient amounts of what it says. But the other piece is contamination. And what the Inspector General would say, the Attorney General, I keep saying it wrong, in New York found was that many of these supplements contained potential allergens like peanut or wheat that was not listed on the label.
Oh my gosh.
Consumer Labs found, when they did a report, and again, I discuss all this in the book, when they did a report, they found that one of the supplements that they looked at had like extremely high levels of lead, toxic levels.
Gosh.
And obviously there's not supposed to be any lead in there. So,
no.
And you can look across supplements from fish oil to standard daily multivitamins to, herbals across the board. It costs money to maintain standards. Mm-hmm. So, people want inexpensive supplements, and I understand, but you're going to get what you pay for without question. And these companies, you cannot have a high level, very highly controlled supplement that tests every single lot to make sure that you've got the highest quality and charge the lowest price on the market. You can't do it.
It's just not possible. Mm-mm. Yeah, it's just too.
That's so insane, though. It's like going to the grocery store and buying a pack of bacon, and you think it's bacon, but it has anything but bacon in it.
Well, that's probably most food, right?
That probably is most food, actually. Frankenfood,
yeah,
right?
It's everything's like
that's shady.
Fruit flavored,
right? Bacon flavored. What are these chemicals? Wow, I did not know the supplement industry was. I knew there were some issues, but I'm going to read that. I'm going to read that book.
And I think that's why so many physicians will say, supplements aren't proven to work. Mm-hmm. Well, when you have a bunch of crap that stuff's getting tested on, well, what kind of result do you expect?
Right.
Mm-hmm. Right. That makes a lot of sense.
And like you said, possibly some damage, not only not helping, but...
That's right.
I want to ask you about, we're just talking about sunscreen and things, and I see as one of your services, skincare. I also want to touch on prolotherapy, but I know we got about 10 minutes. But with skincare, you say that there's 4 of the most common causes of skin aging and damage are. It's interesting the order that you place these, because most people would invert the order. You say number 1, glycation, number 2, inflammation, number 3, oxidation, which is almost like they all almost seem like the same thing. Mm-hmm. Glycation, inflammation, oxidation, and number 4, sun exposure, UV damage.
Right. And in each one of those, we do try to address each one of those, and it's extremely important. And that the issue with glycation, so for the listeners that aren't familiar, that's where blood sugar molecules, glucose molecules, get attached to proteins and lipids in your body, and it is almost like rusting from the inside out. So these glucose molecules attach to these things, and they alter the function of these things, or they alter how your body recognizes them. So we test glycation with a lab test called hemoglobin A1C, and so diabetics will often get that test to evaluate how they're controlling their blood sugar on average. And the higher your blood sugar at any given time, the more you will glycate. So that's why diabetics have such potential problem, because this high glucose level affects so many things. Dr. Perlmutter, talks extensively about glycation and the effect on the brain, and he's done some fantastic work on those kinds of things. And the brain shrinks. As we age, it's going to shrink. But interestingly, the brain shrinks faster with a higher hemoglobin A1C. And we noticed the biggest change is actually a hemoglobin A1C of 5.2 to 5.3. That is well below the diagnosis of diabetes. It's even well below the diagnosis of prediabetes. So we're very aggressive about controlling blood sugar in our clinic, because we know that the higher the glycation, the more damage we're going to have. That's why diabetics lose their eyesight and have retinopathy and their kidney function and peripheral neuropathy. It's all because of glycation. So glycation is very important, and that's one of the things that ages our skin. I didn't mean to camp out on that too long, but I thought it was an important.
No, it's great component. Because sugar is such a huge issue, and we've been doing a lot of work. We're doing more of a kind of a keto kind of diet, but sugar is massive, and I believe, according to the it's not the FDA. What is it? The organization, the governmental organization that determines how much of X we should get or Y we should get, but they say that USDA. Yeah, they say that we should get about 25 grams of sugar a day. And some of these raw food treats and things like that, they'll have 35 grams of sugar in them.
You're looking over at me. I know. I eat these.
We're trying.
We're trying.
But it's amazing. They're raw food. They're cacao.
Maple syrup. But man, they're packed with sugar.
Yeah, it's amazing.
And, if someone's physiology, these are, remember when Cookie Monster went from, cookies are now a sometimes treat?
Yeah, I know it well.
Just made me laugh. But I don't think that assuming that physiology is optimal, we should be able to handle sugar without a problem. The problem is that we're inundated with it. It's in everything, and you can't even, it slides in under the radar with things like maltodextrin and all of these little chemical names, and you can look at labels, and half that stuff is sugar by another name, and so we're just inundated with it, and we don't need it. But sugar acts like a drug in our brain, just like in the same place that heroin acts. Sugar is a drug. That's why so many people have carbohydrate addiction, because it's the same place just like heroin. But we don't need it. And when you get a packaged food, it's the marketers or the developers are going for taste and flavor and those kinds of things. And some of the supplements, and I work a lot with our supplement manufacturer and with product development and how do things taste and things like that. And I've got a supplement that works absolutely amazing, and I'm getting a lot of kickback. And I was getting some patients that are coming in there weren't getting the results that we were seeing with the others, and I'm like, what's going on? And they're like, oh, I couldn't take that stuff, it tasted awful. And it's like, you couldn't just suck it up and just take it anyway. I mean, I tasted it and I didn't think it was bad at all. But for whatever reason, they didn't like it, and we're just in a society where we want it to taste good.
Yeah, you're
because
right.
Everything. And, for the listeners that have gone really low carb and there's no sweet and all those things, and then you try something that would just kind of be like normal everyday food, you're like, oh my, that is so sweet. And you don't notice it until you cut it out.
Right. It's shocking what we get used to.
Oh my gosh, it's crazy.
Right.
Yeah.
Exactly.
I remember, what was it, 2 years ago, we were with my family on vacation up in Lake Tahoe. It was gorgeous. And Justin and I travel with our juicer. We're the funniest people to travel with.
We got our blender.
Our dehydrator. So we take our juicer, and I said, does anybody, want a juice? And my dad said, well, what's in it? And I said, well, you won't like what we have in ours, but we'll make you a good one, a sweet one.
Yeah.
We put like beets, carrots, all this sweet stuff. We give it to him, and he's like, He still wasn't like, like drinking a whatever people are grabbing out of the grocery store. It's horrifying. And we thought, wow, if he doesn't like that, then man, people's taste buds get so used to this like
sugar bomb.
Made up sugar bomb.
Yeah, it's amazing.
Right.
It's sad.
Yeah, it's interesting, Chad, that the 3 of the 4 instances of what you were talking about with skincare are internal processes, and the 4th one is sun exposure, and that's an external process. But most people think, oh, skin, but really the health of your skin is reflected by your liver health, your organ health, your gut health, your colon health. People don't think about all of that. And these 3 things, glycation, inflammation, and oxidation, are all internal processes.
That's exactly right. And it's important. You can address your skin all day long. You could, if you smoke 2 packs of cigarettes a day, you can use the highest quality skin stuff out there 4 times a day, and your skin is still going to be destroyed. I mean, you can't undo that kind of damage. So it's important that we focus on overall health. And I liked Dr. Huizinga from the Biggest Loser. He's the medical director on The Biggest Loser. And he's a friend of mine, and so I've kind of followed him, worked with him a little bit. And I was watching The Biggest Loser one time, and Bob Harper, one of the trainers on there, said that weight loss is a side effect of getting healthy. And I thought that was really interesting, because so many times we're focused on one component. And if you focus on health, everything else becomes much, much easier.
Yeah, I completely agree. And I wanted to talk with you just for the next couple minutes about prolotherapy, because I had some personal experience with it. I've had a torn ACL. I think it was about 95 or 90% torn in my right knee, and doing jiu-jitsu, and it's basically felt like my knee snapped. And as a result of that, I had 6 treatments of prolotherapy. I won't say it's back to normal, but I would say there's an incredible improvement in my pain levels. I had incredible pain. All of that went away. My range of motion has never been better. It's strong. And prolotherapy, I think, was a big part of that. And that's a service that you guys offer too, right?
Yeah, and that was actually fundamental in my transition from traditional medicine to functional medicine. And it's a kind of a long story. I talk about it quite a bit on my podcast, so you can go bore yourself to death with that. But it goes against a lot of mainstream stuff. And because it's pro-inflammation. We're trying to stimulate inflammation, because that's how your body heals itself. And so many things that we do, anti-inflammatories with Motrin and Naprosyn and ibuprofen, all these different things, and all of the things that we do, it's like it's going against the healing process. And use steroids for let's get a steroid injection and get that inflammation down. And steroids are necrotic to the tissues. They destroy the tissues. And our goal is to restore those tissues and help them heal and get stronger. And that's been proven, at least in animal studies, that prolotherapy can make ligaments 40% thicker, 50% stronger than they were before the damage.
Wow.
So it's a very impressive procedure, very simple, very straightforward, very safe. In fact, the former Surgeon General of the United States, C. Everett Koop, said the nice thing about prolotherapy, if properly done, is it cannot do any harm. So we are doing injections, and you have to be careful. You have to go to someone that knows what they're doing as far as the injections, because we're sticking needles into places that you can't see with the naked eye, and we're injecting a very simple solution that stimulates your body to heal itself. And it's just absolutely fantastic. It's been around for nearly 100 years. It's been shown to be very safe and very effective.
Yeah, it's an amazing thing, and people are starting to use different cocktails and different, I guess, serums and things like that.
Did you have something thrown in yours? Was it ozone or something?
I don't know if I had ozone. I had, I don't remember what was in it, but I know that people are doing some pretty cutting edge things, right, with Prolo.
Sure. Now, in mine, you go to a bunch of different prolotherapists, and you're going to find a bunch of different little cocktails. And I'll tell you, I keep mine very simple, because it's proven to work in my patients. So if it's not broke, don't fix it. Now, I do a spectrum. I do basically my 3 different levels are going to be prolotherapy, which is the lowest cost, tends to require on average 3 to 6 rounds of the procedure for the patient. I get some that get better faster than that, some a little bit slower, but it's the lowest cost per procedure. Then I also offer platelet-rich plasma therapy. A lot of the athletes, professional athletes, have had platelet-rich plasma therapy, or PRP, and it's a little bit more potent than prolotherapy, certainly a little bit more expensive, but we get great results with that as well. And then the last thing is stem cell injections. And I usually combine that with PRP just because we want to get that inflammation as well. And we get, and that's really good for inside the joint. So like inside the knee joint, inside the hip joint would be the two areas that I focus on the most. So I offer the spectrum in that way. Now, as far as injecting different solutions in my prolotherapy, I've kept it very basic because it's just been shown to work. I don't have to worry about, okay, in this patient you can't inject this, and this patient you can't inject this. And one of the reasons is because when I was looking into prolotherapy, the Cochrane Reviews, large collaboration where they look at the evidence on different topics, and their conclusion about prolotherapy was that it didn't work. And I said, well, I've got a real problem here because I see that it does. They're saying that it doesn't. So what's the issue? And so I started looking at the studies that they reviewed, and I came to the conclusion. And I talk about that on my podcast, on my website and things like that. And I understand how they got to that conclusion. It's an inaccurate conclusion, but they drew it from not looking at all of the data, if that makes sense. But anyway, so one of the issues with some of the I lost my train of thought. Was it the solution that I was going to talk about?
Yeah, I think it was the solution of the prolotherapy in the knee.
Oh, okay, yeah. So as I was looking into the data behind prolotherapy, again, going back to what we talked about first, is balancing risk and benefit. And the risk of prolotherapy is minimal. In fact, the last studies, as I started digging into this, the last studies of any harm were published in 1956 and 1957. Oh, wow. And so we've got a long track record with prolotherapy. And the solutions that they injected that caused harm had like phenol and these different solutions where they were getting creative, but they got injected inadvertently into the spinal column, and they caused an inflammation in the neurologic system, and a couple of patients died, and some were paralyzed and had some long-term sequelae. So with the solutions that we use, they are very, very safe. I could inject them directly into the spinal column and not have any problem. So I know this is safe. I know it's effective. Just keep it simple.
Yeah, that's good. Are you familiar with Regenikine?
I don't know that one.
That's it's a solution. It sounds like it's similar to prolotherapy, but it's only been around for a few years, and a lot of the sort of athletes, like I know Kobe Bryant flew to Germany, I think, to get it done because they can't offer it here. But there's, I think, a doctor in California. I think they're starting to loosen the grip a little bit on it. It's called Regenikine, and people just swear by it, much the same way they do Prolo. But I actually have to look into it further because I don't know too much about it, other than some of the high end sports athletes are getting it done, and it sounds kind of similar.
Okay, and as I'm looking at it here, it looks like it's uses the body's own anti-inflammatory proteins and human growth factors to reverse pain and chronic injuries. So similar to PRP, the concept is going to be the same. It's using a different solution. I don't know anything about this particular solution. And, again, I go back to, we've got nearly 100 years of data on prolotherapy. It's been shown to be safe and effective. So in medicine, they often say you don't ever want to be the first one to use something or the last one to use something.
That's
or
true.
Both.
Or both.
In a bad situation.
Exactly.
Yeah. No, that's true. So it's cool though. In today's world, there's always new things to study and to learn, and to, all kinds of new stuff coming out. So it's fun though to see what's going on. And so Doc, if people want to get a hold of you, you've got your podcast, right? The Against the Grain podcast.com, and it looks like some really cool stuff there.
Yeah.
I wanted to ask you about the vitamin C injections, but I know you have a patient you got to get with. So that sounds really cool. Againstthegrainpodcast.com. And then can people work with you remotely if they want to?
By law, they have to be an established patient, which means I have to see them face to face. Once we've done one face to face, then yes, I can do remote care. So it makes it difficult for some people.
Whereabouts are you located?
In Tulsa, Oklahoma.
Tulsa, Oklahoma. Okay, so people can go out there.
We have great beach here. So just come go to the beach. I'm just kidding.
I'm trying to picture where the beach
get your
would be.
leathery cowboy skin on. And then we'll come see you for some from skin treatments.
There you go. I mean, Tulsa, Oklahoma, this area, northeast Oklahoma, northwest Arkansas. I mean, it's a beautiful, it's beautiful country. It's
I bet.
not the flat plains like western Oklahoma and boring. I think it's very pretty. It's not, the tall trees like North Carolina. It's not the coast of California and all those kinds of things. But we've got our own little charm.
Oh, I bet.
That sounds great. Sounds like a nice spot. Yeah.
Yeah.
Okay, so your website for people who want to get a hold of you is revolutionhealth.org. Is that correct?
You got it.
And do you have anything else going on you want to let anybody know about before you get to your patient?
Oh, I've got like all kinds of things going on. But again, everything, we do a lot of, probably the biggest thing that we're currently doing is bioidentical hormone replacement therapy with pellets, using very, very high quality pellets. And patients are it's really blown me away. I've been doing hormones for a long time. Uh-huh. I'm getting better results with pellets than I got with a lot of other things, and it's almost a whole nother podcast. But we do a lot with that, and from athletic performance to just fatigue, and I feel bad, and helping them to kind of restore vitality. It's just a great way to go. So we've been doing a lot with that, and trying to grow the nutrition and the IV nutrition and those kinds of things. So anything that we can do to help patients get better, it's on the table.
That's awesome, and. Yeah, that sounds really great. Is that for women and for men?
Absolutely.
Good to know.
I love that. Okay. Yeah, a lot of issues today with hormones, especially with the BPA like we were talking about before.
Unfortunately.
All right, Doctor.
I'm sorry, one more thing. Even with women that are premenopausal, in other words, even in their 20s and 30s, many times we give them a little testosterone in pellets, and they do amazing and can really help with their fatigue and feeling bad and their mood and all of those kinds of things. So I would consider that for a lot of patients.
Is that a topical?
No, with pellets. You can do topical. It's just I see inconsistent results. Some women absorb very easily, the creams easily. Some do not.
Okay. Okay. Gosh, so fascinating.
Is it safe to say, one last question? I've been on this, bioidentical progesterone cream for years, and it doesn't really seem like I'm changing much. Is that a good indication that it's not working for me if I don't feel different?
Well, I would argue that that's probably the case, but it's one of those things where if your right front tire is flat on your car and we change your left front tire, it's not going to fix the right front tire. Mm-hmm. So it's all about getting the right solution for the right problem. Yeah. And you may have needed to be on progesterone and why they started progesterone, but there may be something else that's going on. And it's all about hormone balance. So you may need the progesterone, but you may also need one of the other hormones in combination. And then there could also be, there could be some issue with adrenals or thyroid or a nutritional deficiency or, any of these other things. And it's all about identifying the real problem and fixing it.
It's a never-ending journey, isn't it?
That's right. It's a lifelong journey.
I'm okay with it. At least I'm here to experience the lifelong journey.
These bodies are complex.
Yeah, they are.
All right, Dr. Chad, I know you're on the run. So thanks for your time today. I really appreciate it.
Hey, I had a great time. Love talking about this stuff. It's a true passion. So again, it's a true honor to be here.
Awesome. Hang on the line for 1 second, and we're going to close out the live show. I want to thank everybody for joining us. This was episode 440. So if you want to catch the show on the website, it's extremehealthradio.com/440. We will be back on Monday and Tuesday and Friday of next week. So look forward to those shows. Lots of good stuff coming up. And if you want to visit Dr. Chad, you can go to revolutionhealth.org. And we appreciate you all so much. If you enjoyed the show, pass it on to your friends and let everybody else know. That would help everybody involved, and we would appreciate that so much. All right, guys. Love you all. We'll catch you guys on the next episode. Dr. Chad Edwards.
Really enjoyed that one.
Nice guy. Very nice guy.
I thought that was a great overall. We touched on a lot of subjects, and all of it was good.
Yeah.
None of it was boring. I think there's a little something in there for everyone. He's a great, great guest.
Well, you know what's interesting? Here's a concept that this might sound a little controversial coming from me and from us, but you have to face it at some point. And this, originally, the idea of this came up when a friend of ours, Dr. Richard Massey, he talked about he's about as holistic as they come. And Dr. Edwards too, did you see one of his latest podcasts was on EFT?
I did see that.
Emotional freedom technique, which is very much the same thing as tapping. So that's, you don't do stuff like that without really understanding energy medicine and things.
Right, you're pretty turned on.
And Dr. Massey is the same way, completely this way. And one time Dr. Massey said, it's a good thing when someone comes in and they're having acute pain from a chronic condition, because we always make the distinction between chronic pain or chronic disease versus like breaking your arm, acute condition.
Right.
But he'll say someone is in such acute pain from a chronic condition that sometimes pharmaceutical medications can be nice and come in handy until we can get that person at least out of inflammation and back into baseline, and then we can start working on their health. And so there's a couple experiences in my life that have, people listen to this show think we're bashing medicine and just only believe in chronic,
natural treatments, protocols.
But I have to say, my mom and my recent issue with my back are two instances, and then Dr. Edwards here and Dr. Massey saying that if they're forced and pressed, they will do something with pharmaceutical medications. When there's
a time and a place, the perfect soup.
Right. And so my mom is the whole reason why I got into this, and she was researching back in 1995, Gerson and all this stuff, but she decided to go to the City of Hope and get chemotherapy and radiation, and the doctors gave her 10% chance of living. She went through chemo, radiation, and surgery.
And bone marrow transplant. And she's still alive. Yeah.
So the 5-year survival rate of that is it's minimal.
It's been how many years for her? 22?
Yeah. So it's hard because much as I don't want to promote that, what do you do with that? Mm-hmm. You know what I mean?
I know. You have to ask yourself an honest question.
Yeah.
Does it work for some people? Seems to.
It seems to, right? Ultimately, it's God,
Sure. It wasn't her time, but...
What do you... And then this recent episode with my back. Mm-hmm. I actually had to take a medication. It wasn't a medication. It was just over-the-counter Tylenol.
Advil.
For the first time in 14 years.
I know. For days. To help the inflammation go down so you could get out of bed and walk around.
So what do you do with that? As a natural guy, I tried everything. Super high doses of turmeric, super high doses of DMSO, magnesium. I was doing
all kinds of internal and external pain rubs and enzymes. And
But then this lady came over, and we're going to have her on the show hopefully one of these days. And, she's completely into natural stuff too, but she said, honey, you got to get that inflammation down.
You're beyond
the point. It's hitting your nerve. This disc issue is hitting your nerve. You can't move. The pain felt like someone was shoving a hot butter knife into my back, and I could not move. And I took this Advil, I think it was, Advil. And I took it
in a liquid form, by the way, which she was, she said it assimilates into your body better than taking a hard packed.
And I hated doing it.
I know.
I hated doing it because part of my ego is like, hey, you haven't taken a thing for 13, 14 years.
But and you should be able to figure out a way to get this down naturally. But we're at the end of a rope there.
I was the most natural you could come. We're doing hot packs. We're doing everything we can think of. And nothing was touching this thing. And so...
There is a time and a place.
Yeah, it's hard to bash it all,
I know it is. I know.
You want to, but...
I know. But like Dr. Edwards is saying today, when reserved for emergency type situations, I'm thankful that those things exist. I think they're same with antibiotics. I'm the biggest kind of antibiotic person, but man, if you're in a life threatening situation and you've tried everything and that's going to be the one thing, of course you're going to do it to save your life. Then the ego needs to go out the window. And but I think the problem is people take this stuff like candy and they want a quick pill and a quick fix for things, and that's just often the Band-Aid scenario we run into when you're not addressing the root. But man, I don't know what you do with that other than I really do believe, like you said, that God allows us to be here or not be here. And ultimately, your God wanted your mom to still be here. So had she done natural treatments and would she have survived? I don't know. Who's to say,
Yeah, I would like to think that. And I would like to think, there's no question chemo's damaged her body and aged her and really wreaked a lot of havoc on her body, and she's still alive. So
but she's had a good life. She's here.
Yeah. So it's amazing. I like what he's doing over there.
Yeah, that clinic looks awesome. Did you look at a picture of the building?
No, where is that under?
Under contact, I think.
Contact.
They show a pic. I think so.
Revolutionhealth.org.
Go down a little bit. They show the picture of the building.
Oh, look at this.
Keep going.
Whoops.
Oops. There you go.
Oh, that's cool.
Yeah,
Wow.
beautiful trees. And it does look like it's in a beautiful place. Tulsa, Oklahoma.
Look at all this land around it.
I know. Isn't that gorgeous?
My goodness.
I know.
Like, this is just an incredible amount of land. We don't see that kind of land here in California, do we?
No. You know what it reminds me of is Dr. Nunley, Dr. Stuart Nunley, our dentist in Marble Falls, Texas.
Oh, yeah.
When you go out there, it's a really beautiful, building, little building, clinic, but you go beyond it and you go right by, and sure, there's a few grocery stores and hotels and things and little businesses, but there's just this sense of spaciousness and just this freedom of feeling like there's some land around you, like looking at Dr. Edwards' clinic, where you just feel your soul feels like it can breathe a little bit.
It does.
Great place for people to go, get treatment in areas like that where you can, you're not in a mini mall complex. Like, unfortunately, here in Southern California, whenever you go to a doctor, you have to leave an hour early to get 5 minutes up the freeway, to go into a giant parking structure, to pay to go to a hospital to visit someone that might be ill, or had a baby, and then you have to fight with all this and it's like, gosh, this does not promote health and healing. I want to kill people. I'm on my way up here, and I feel like I'm going to end up in the hospital from stress,
From a heart attack.
So I think it's really important where people go to get their treatment as well. Is a big part of the deal.
I really like him a lot. We've talked
great.
to a lot of people. He's cool.
I want to listen to some of his podcasts.
Dr.
He has some videos up, and he's doing some great stuff, isn't he?
Yeah, it looks like he's doing, so you could work with him. It looks like he's doing a lot of paleo stuff too. But yeah, he's got a bunch of cool podcasts. 12 Steps to Get Better Sleep. Nice. Episode 46, Medication Kills, Epidural Steroid Injections, Estrogen in a Nutshell, MTHFR, Gene and Methylation.
I want to listen to that one.
Omega-3 Fish Oil, Paragard Contraceptive, Hormone Pellets, Does Testosterone Cause Prostate Cancer, Gut Microbiome. He just does a lot of stuff here.
How many episodes has he had?
Lyme disease, episode 31. Acid reflux. Let's see. He's got 51 episodes.
Good night. Is it him? It's just him talking? I
don't know. I was going to ask him about that, if he has a co-host or anything, but he's got, his latest one is called Active Serum. I didn't know, episode 51. I don't know what that's about. I wanted to ask him, but I knew he was pressed for time.
I would really like to have him back on.
Yeah, we can get into some subjects.
I just want to talk about vitamin C injections too. What were you going to say?
Well, I was thinking maybe, next time we could have him on is get into a subject, like a specific topic.
That'd be great.
That might be kind of good.
That'd be really great.
Yeah.
I know with the popularity though of the MTHFR thing, it's I love talking to people about that subject. I think it's coming early next week. I'm just finally going to order that 23andMe and do it. I've been talking about it for months and probably years now, and I'm just curious. You're going to let
Google's founder's wife own your DNA?
Yes.
Does she have any connection to the Georgia Guidestones? Depopulation?
Those are rabbit holes I'm just not willing to go down on this episode.
Yeah,
but I don't know. I think that, it might be the cheapest alternative to getting going into a clinic and spending, you could get up to the thousands, hundreds, if not thousands of dollars of tests. And, we've talked about, you and I, they already have if they want your info, they're going to get it. They've already had it. I mean, you send vials of blood off to a lab. You don't know where that goes. It's like, at this point, I'm picking what I think is an okay thing and just trusting that,
Remember, the
it's
guy,
be okay.
What's his name, who made our pyramid for us, Upper Echelon Orgone on Instagram? He has a picture on there, and it says, it's like, when you find out that or Snapchat or whatever filters are just facial recognition software, and it shows a picture of a worried person, the day you find out that Snapchat's filters are facial recognition software.
But, we're living in this world, and, ultimately I just go, God is in control of all of it, and whatever information people are going to have or not have on me is kind of none of my business. So,
you know what? One thing though, too, on the MTFHR, and we'll sign off here, that it's really important, I think, if you get it done, to realize that's not you.
Well, right.
To have a strong understanding of like I know you do, of Dr. Lipton's work and epigenetics, because even though it says that, it's almost like
Like I was saying about my friends that have freaked out when they get this info and they start becoming different based on a test.
Like, oh my gosh, I can't do this. And kind of what Chad was saying is people come into him and say, oh, I can't do this, can't do that. But realizing like, wow, do we have a strong enough mental and spiritual awareness about ourselves to be able to just say that even though no
matter what my body says,
my body possesses this gene, I can just switch it off.
Right.
And so it's important because if people don't realize that piece of it, then it's challenging because then it's like they think they're their name, they think they're their opinions, and they have all this identification issues. And then you realize like, oh crap, I've got this gene, there's nothing I could do about it.
Right.
And that's a problem.
That's a problem.
Yeah.
It's funny because with me, I'm so curious because I've just listened to my body for the last few years and watched its decline in some areas and go, why can't I eat this way? I have the earmarks of having that MTHFR. It wasn't like I went out, got it, and then was like, oh my gosh, I can't eat any food. Mine has been a whole different progress. It's been the complete opposite. So that's why I'm just curious. It doesn't mean I'm going to treat different or freak out if I have this thing. I'm still on the same journey back to healing, and you know, I'm going to be fine. But it's an interesting thing that it's like all of a sudden one day, if you're told you have cancer and the day before you didn't, all of a sudden you're sick in bed. You buy into it and your brain goes down this really not good place as far as getting control over. You know, your mindset is a huge part of healing. You know,
one good thing that you've been doing a lot lately is like, for those that listen to the podcast on a regular basis, your body has a fibroid, and you always refer to it now as the fibroid.
Right. I used to say my fibroid.
My fibroid.
Right.
Yeah. And so it's languaging is important, and understanding your true nature of identification, not realizing like the other day, we were at the health food store and we overheard this guy talking to one of the people working there. And he went on and on about how I have Lyme disease. And, you know, it's just, it's disease starts in the mind first, you know, and then it spreads because of this idea that we have that, you know, how could his eternal soul have Lyme disease? How could your eternal soul, the true essence, the energetic vibration and spirit of who you are, how could it have any physical ailment at all? It can't, because it's not your body.
Right.
So the truth is your body is dealing with a fibroid, but you don't have any fibroids. No one has cancer. No one is sick.
Right.
Really.
Right.
So that's a hard part because we have this I have syndrome, you know? That's
a great way to say that, the I have syndrome.
Yeah. It's weird. I mean, our friend went through with it, and our friend Christy, who's got her body has
rheumatoid arthritis.
Is dealing with rheumatoid arthritis, and she would say the people she would talk to that is going through similar journeys started to call it my RA because it's like this little, you know, cute little nickname they have for their pet, you know, disease, and it's like, wow, that's the first place to start, you know. It's not identifying. It's easy to say.
The first crack in the armor is buying into this is me. It's a label that wraps itself around me. It doesn't have anything to do with us, like you said.
Yeah,
I just encourage everybody out there. I thought that was really encouraging talking to him, to be honest. Thought that was great.
Dr.
Great conversation.
Chad. Yeah.
Very hopeful.
Very, very cool guy. Revolution.
If we're ever in Tulsa, know where we're going.
I know, right? We're going to make a sharp left and head up revolutionhealth.org.
A sharp left, depending on where we're coming from.
I don't know where we're going. We'll be on the road. We'll make a sharp left, and we'll end up at Revolution Health and Wellness.
You are hilarious. If anybody wants to know how to get there, just ask you.
End up in the middle
Wherever
of the
you're
woods.
going, just make a sharp left and keep going.
They'll end up in the middle of the forest.
You're hilarious.
So their their phone number is 918-935-3636. And if you we don't have any connection with them, but just let them know if you go there and say hi, tell them we said hello. So
yeah, please.
revolutionhealth.org. All right, everyone. Thank you for listening. We appreciate it. This was episode 440. So if you want to listen to it on the website, it's extremehealthradio.com/440. We thank all of you guys who donate to us on Patreon, and we really appreciate that. A lot of people are doing 25 cents or 50 cents a show, you know, $1, $2 a month that ends up being. So we really appreciate that a lot. That's really, really nice. And it's really helps us keep things free for everybody. And we also want to thank you guys for bookmarking and using our Amazon link when you make your purchases there. Some people have been writing in lately, do I need to buy health products or anything? You can buy anything you like on Amazon if you go through our link before each purchase. it helps us. So that's another way that you guys can help. And I really appreciate you guys doing that, because the more people that do that, the more we're able to continue doing our shows. And we've got lots of great stuff planned for you and lots of goals. So of continuing expansion. So thank you for that. I really, really appreciate it. And also continue to look at our store. We're going to be adding some more products to our store. We've got probably 50 products or 70 products on there by now. Lots of cool stuff. Rebounders, saunas, juicers, blenders. We've got the Vitamix and the BlendTech. We've got Qigong programs. We've got so many things on our store that you're not going to really find anywhere else. So that also helps keep us free too. So thank you for your patronage there, and I appreciate you guys so much. And
hope everybody in the next few days listening to this has a lovely 4th of July.
Yes.
Whatever that means for anyone.
Oh, we don't want to get into politics now.
No.
Or maybe later.
Fun reason just to have a fun, long, extended weekend.
Yes.
Hope that's fun for you guys.
Yeah, thanks everybody. We love you all, and we'll catch you guys on the next episode.
Hey everybody, this is Josie, Justin's mum. Don't tell him, but I know he would absolutely be really happy if you would sign up to his free weekly newsletter. And don't forget to share this with all your friends. This is the buzzing bumblebee signing off.
That's so good.
Hello.
Oh my gosh.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this